Marcus. I want to take a few minutes of your time to talk about a critical care medical surgical presentation, neurological Parkinson's. Parkinson's disease is no known cause. Sometimes there's a genetic predisposition for Parkinson's, and basically what's interesting about it, its etiology is very specific. It has to do with the dopamine. Dopamine is a neurotransmitter that the brain produces, and what happens with Parkinson's, these patients are unable to excrete it anymore. It starts to be damaged. According to ATI, there's 5 stages to Parkinson's. Many times initially these patients just start with fatigue, have trouble with tremoring, but as they go along and have degenerative problems, they change. Initially, stage 1 is one side of problems, shaking, tremoring. Stage 2, bilateral. They start to have balance problems. Stage 3, they physically cannot move, are ineffective with their walking. Stage 4, tremors may decrease, but they have rigidity. They actually freeze in place. They freeze. Stage 5, they're unable to walk, and they also can have dementia. We want to understand the medications. We want to replace the dopamine that the patients cannot produce any longer. Cinemat is levodopa, is given to these patients. Through my career, I've been told by Parkinson's patients, I need my meds now. Get my Cinemat now. Because they start to see where they're getting rigid or the tremoring is becoming apparent. So we need to understand with the medications, there are some side effects. First of all, titration is very important as far as how you give these medications. ATI wants you to know, besides predispositions can include males ages 40 to 70, and also environmental toxins can promote signs of Parkinson's. Some of the other signs with the tremoring, we talked about the stages, but within that, you can have the pill rolling. This is many times asked. This is very definitive for Parkinson's. Shuffling gait, propulsive gait, stoop position. Muscle rigidity we mentioned, difficulty chewing, swallowing, orthostatic hypotension, blood pressure drops, drooling, dysarthria, they're unable to articulate, and they have mood swings. We want to assess the patients. We want them to have small, frequent meals. We want to make sure they don't have trouble, as I said, swallowing those meals. The medications they give, levodopa, which converts to dopamine. That's your Cinemat. And many times, as I said, they're adjusted, these medications, and so they don't wear off. Some of the medications we give help keep that dopamine in the body. Anticholinergics help also. Anticholinergics, though, will cause dry mouth, so you need to know that. Some of the medications specifically are ketocholmethyltransferase, COMT inhibitors, and these decrease the breakdown of levodopa so that the dopamine stays in the blood and they continue with smooth movement. However, you need to know that the urine will be dark with this. ATI mentions this. Another medication you're responsible for with Parkinson's are MAO-B inhibitors, monomaxine oxidase inhibitors. And you need to know that they need to avoid foods high in triamine. Triamine is in cheeses, smoked meats, beer, some fruits that are overripe, soy products, and certain beans. They also say for Parkinson's medications to avoid reactions with Demerol, which is meroperidine, or fluoxetine, which is Prozac, which you may be familiar with. Also, they want you to know sometimes they do deep brain stimulation with Parkinson's. Michael J. Fox, I believe, had this done to help them with their movement. So, some of the ATI questions I've seen on Parkinson's is on the stages and the differences in the stages. Would they need a walker, for instance? Let's just review those stages one more time. Stage 1 is unilateral. Stage 2 is bilateral, and you start to have balance problems. Stage 3, physical movement slows down, and now they cannot walk properly. Stage 4, tremors may decrease, but they freeze in place. And stage 5 is obviously the most acute. They're unable to stand. You need to understand some of the side effects of the medication. Also that we need to know that give them regularly the same time each day. The urine changes with the COMT medication, and also avoidance of the triamine with the MAO-B medications. That's basically it in a nutshell. These patients continue to work with the Parkinson's disabilities. Sometimes a walker may help them, sometimes not. They are very careful with their movements and mostly very succinct on the delivery of the dopamine. Thank you for your time.